high blood pressure in pregnancy, how serious this is, how to manage high blood pressure in pregnancy, what are the complications when you leave high blood pressure unmanaged in pregnancy, what happens to you and your baby. Can you breastfeed your baby if you're taking your high blood pressure medications? And the foods that you eat, how to manage this naturally. And what question again are we going to be taking? Yes, how to reduce the risk of having high blood pressure in pregnancy. Okay, if you have high blood pressure already, before you get pregnant, okay, what you will do. Okay, so this is what we're going to be discussing in this video, so please do not skip at any point, because the point you skipped might be the most important thing that you need to know. So my name is Nurse Merit and I'm a nephrology nurse. So if you're just coming, this is your first time here, please subscribe and turn on your notification button and share this video so that every woman, whether pregnant and unpregnant, will be aware and take care of their health. Now, I'm going to let you know first of all, I'll start with the problems that will happen, what will happen to your baby, God forbid, not you, to the person's baby when they have high blood pressure and they leave it untreated in pregnancy. Number one, placenta abruptio. Placenta abruptio means that the placenta just attaches unattaches itself from the walls of the uterus. Okay, and the placenta supplies food, nutrients, oxygen, blood to the baby. So when it attaches itself off, the baby is in harm and risk of dying. And apart from this, the baby will either die or the baby will lose a lot of function, okay, and there will be a lot of bleeding. Okay, lot of bleeding. The woman might lose her life if nothing is done urgently. So you see, this is a serious something. Now, the next thing that may happen is premature delivery. When the baby when the placenta unattach itself, okay, supplying the baby can become in distress. And of course, the doctors, if you go to the doctors early, they have to deliver the baby. Okay, so this may lead to premature delivery. Now, the next one is injury to your internal organs. Yes, like the kidneys, like the heart, like the liver. When your blood pressure is so high, it's makes your kidney fail because it destroys the blood vessels. Yeah, it destroys the vessels, okay, in the kidneys. Okay, so it destroys the kidney. Most of the times, if nothing is done early, the person can come down with chronic kidney failure. This is why most women are coming down with chronic kidney failure. Okay, a preeclampsia can occur. Your heart, of course, I've made a video about high blood pressure, so you can watch it fully about high blood pressure causes and all of those things. So your heart, you can have a risk of having stroke, you can have a risk of having cardiac failure, a lot of cardiovascular issues. So please, this is not good for you. Now, the next thing that can happen to you when you leave blood pressure in pregnancy and you leave it untreated is future risk. Yeah, when you have preeclampsia. What is preeclampsia? First of all, this happens when blood begins to protein begins to leak in your urine, and this is not supposed to be so. When protein leaks in your urine, it means that your liver, your kidneys has become enlarged. The filtering system in your kidneys has become porous, that protein leaks. Protein is not supposed to leak from the kidney. It's not supposed to come from the kidney because protein is too big to pass into your kidneys. Protein, sugar, they are too big. Okay, so but when you see protein in urine, means something is going on in the kidneys. So preeclampsia, you see protein in your urine, you see the woman's leg swelling, BP is so much high. So when you have this in your pregnancy, chances of having it again in your next pregnancy is high. Okay, so future illnesses, okay, future illnesses to your kidneys, to your heart, and your liver and all of those things. So please, this is why I know why I'm trying to do this first before going to hypertension in pregnancy proper, so that you give me your undivided attention, whether you are pregnant or you're not pregnant. This is not a topic to joke with. Now, most women are asking me, I have high blood pressure, what will I do? That is not the right question. You have to meet a doctor. You have to be managed well, especially if you are pregnant, right? So that is the question. Now, the next question on high blood pressure is, can you get pregnant if you're hypertensive? Absolutely yes. There is no issue having been pregnant and then you're hypertensive. All you need to do is to work hand in hand with your doctor. Okay, now if you're hypertensive already before you got pregnant, you have to be careful. Okay, you have to take your drugs. Your drugs will be changed. Please be aware of this. Okay, your drugs will be changed because there are some drugs that are not good if you're hypertensive. If you're pregnant, yeah, if you're hypertensive and you are pregnant, your doctor has to change your drugs, certain, okay, and then give you aspirin, which you have to take every day because it reduces the risk of preeclampsia and blood clots, okay, traveling, up to your heart and stuff. So you have to monitor it, take your drugs, okay, and then when you leave this thing uncontrolled, you're already hypertensive, you get pregnant, you're not doing anything you're supposed to do, it becomes a problem. It can lead to preeclampsia, just like I said. Now, the next question is it safe to take your BP drugs if you're hypertensive? If you are pregnant and you're hypertensive? Absolutely yes. However, like I said, it needs to be reviewed. If you find out that you're pregnant and you're hypertensive, already, just go and tell your doctor that you're pregnant. He knows what to do. He knows the drugs to add and what to remove, okay? However, there are some other things that you need to do that will help you manage your high blood pressure, whether you are, for the sake of those that are coming now, I made a video on natural things to do to help you manage your blood pressure. You can locate the video here on my YouTube. I also make a video on foods to eat and to avoid, because I can't make it obviously here, to manage your high blood pressure for everybody, okay? But don't worry, for the pregnant ladies, I'll give you what to do. Now, how to reduce the risk of complication. These things I mentioned from the beginning. How to reduce the risk of, so that it doesn't happen if you are hypertensive. Number one, you need to work hand in hand with your doctor. Make sure you start antenatal immediately you are pregnant. Start your antenatal. Do not wait for 2 months before you start. Start immediately you find out. Let your doctor know that you are pregnant. Okay. Number two, please, you have to also help in working out, even if it's going up in a day, going from, your street, around the street, do exercises, okay? It will really help you a lot, okay? Now, take your drugs judiciously, especially that aspirin they gave you. It is good in pregnancy. Take it. Now, reduce the salt intake. Very important. Salt increases your high blood pressure naturally. And then when you're pregnant, it also makes your drugs not to work. Okay, so please reduce your salt intake. Eat fruits, vegetables. Make sure you check your sugar level every now and then, okay? And do not miss your doctor's appointment. When you have an appointment with your doctor, please make sure you go and see your doctor, okay? This is very, very important. Now, the next one is, make sure that you do not do exercises that you're not told to do. Okay, if your doctor says you should rest, please rest. If your doctor say don't do exercises for now, please don't do. But anything you're doing, make sure to ask your doctor your health first. Okay, now sleep is very important. Rest is very important. Reduce stress. Okay, if your husband is making you angry or abusing you, something like that, please think about yourself and your baby first. Safety first. This is a very important stage in your life. You can either report to authorities, or if it's something that you can, he's not abusing you, he's not beating you or something like that, don't stop poking, stop doing things that will make you think a lot. Care for your baby first and come out of this of your pregnancy journey. Okay, so make sure you take your prenatal vitamins, Fruits and vegetables, very important, okay? And walk hand in anything you notice blood in urine, you notice that your legs start swelling, of course, it's okay. But once you notice your legs start swelling, please see your doctor first so that everything will be checked, especially if you have high blood pressure. Okay, your legs start swelling, you see your urine start foaming a lot. Bubble is different from foaming. Please, my next video I'll talk about foaming urine. Make sure you see a doctor. Okay, I hope this video helps, and have a lovely day. Let me know if you have more questions, and God bless you.